I just want to take a second to say thank you so much, Phil Murphy, for ruining how I feed my family and my business. I opened post-COVID. We were operating under an executive order in which nurse practitioners did not require a collaborating physician. A collaborating physician in the state of New Jersey does nothing except collects a paycheck. I basically have to sign over all of the ownership of the medical part to a physician who's never going to see you, never going to talk to you and treat you, because that's New Jersey state law. I really don't see us being open much longer.
A lot of nurse practitioners and probably some PAs are pretty upset in New Jersey right now. Hi, I'm Dr. Kate D, and I'd like to explain what's going on and why there is so much consternation and why potentially a lot of med spas in New Jersey are about to shut down. So as of this recording, it is now close to the end of January, and the governor of New Jersey recently signed an executive order ending a previous executive order that was enacted during the 2020 COVID pandemic. So during the pandemic, as many of you will remember, it was really hard to get medical care. And New Jersey changed some big rules in order to allow nurse practitioners and PAs to operate independently in order to take care of primary care patients. They also actually allowed people who had licenses in other states to practice in New Jersey, even if they didn't have a license in New Jersey, so that they would be able to have visiting people. A lot of people went to New Jersey. It was kind of the epicenter of the pandemic in the beginning. A lot of people went there to help out. My best friend from high school was a physical therapist in one of the major hospitals in New Jersey that was just inundated during that time. So I got a lot of stories back then about what it was like in the hospital. So imagine the world when, everything's falling apart, everybody's sick, and we just don't have enough medical providers to take care of them. So New Jersey enacted this law. And as a byproduct of that, nurse practitioners and physician assistants were allowed to practice primary care independently. Now, I didn't know that law has been, basically that executive order has been in effect for just about 6 years now. And so, first of all, what are nurse practitioners and PAs? Many of you will know this, but nurse practitioners are registered nurses who go on to get an advanced nursing degree. And so they're more than just registered nurses. They can make, more decisions. They have more training and more education. Physicians assistants go to school for 2 years. It's like a master's level degree. Both of these degrees are master's level degrees, a basically 2-year degree. There's no additional residency or training for them. But usually what happens is they get a job in a certain area and then they get lots of experience and training on the job. There are currently, as of today's recording, 28 states that allow some degree of independence for nurse practitioners. Some states allow complete independence, and other states have a kind of more collaborating physician law. And the other states, you cannot practice independently at all. You have to be under a doctor. Now, whether nurse practitioners can practice independently, that is a fraught topic, and we'll get to that. And there's quite the turf battle affecting that. So in 2020, those changes were made. And as of January 16th, that executive order was ended. And New Jersey's laws are reverting now to what they were before the COVID pandemic. Practitioners have 30 days to comply with the old regulations. So why are so many people upset in New Jersey? Although this law was enacted, this executive order, I should say, was enacted to promote primary care, what happened was a lot of nurse practitioners went out and set up new businesses doing aesthetics and IV bars and things like that under their new privileges. So many med spas were set up by nurse practitioners and they didn't need physician collaboration. And so now those people are being forced to either find a collaborating physician or stop practicing. So interestingly, right? So the executive order wasn't ever meaning to help nurse practitioners do med spas. I mean, obviously not. Interestingly, let's look at Florida here for a second. Let's turn to Florida for an example. So Florida in 2020 actually passed legislation to allow nurse practitioners to practice primary care independently. But they very specifically made the law so that their scope of practice is only primary care, nothing else. So recently, just this last week, there was a study that was released in Florida that looked at 325 autonomous nurse practitioners in Florida, and they found that 194 of them were practicing outside the scope of their license, meaning they were not doing primary care. The vast majority of them were in med spa, aesthetics, and IV bars. Exactly 60% of the nurse practitioners were practicing outside of primary care and actually illegally in Florida. So let's go back to New Jersey for a minute. So the emergency order was just that, an emergency. And so anyone starting a business in the last 6 years based on an emergency order, you have to know that that's pretty risky because it's going to expire eventually, right? Now, they could be hoping that new legislation would be passed in New Jersey, and that's very possible in the future. I know that they were attempting to pass a bill to allow some degree of autonomy for nurse practitioners in New Jersey, but that did not progress and has not succeeded thus far. So it's very interesting. I know that there are a lot of people who are upset about this, but if you're starting a business, you have to look at all the risks. And clearly, the ability to do this business at all, being legal only under temporary order, you have to know you've got to be risking your livelihood and your business if that order, finishes, which it has now. Interestingly, this situation is very sort of comparable to the GLP-1s being temporarily available via compounding. Let's look at that. So GLP-1s, as you all know, are really great for treatment of diabetes and obesity. And oh, by the way, it's a kind of miracle drug for losing weight. And because those drugs, when they first came out, were so popular, there was a shortage, a national shortage. And the FDA, when there's a shortage like that, will sometimes, not very often, I will tell you, but they will sometimes put a drug that's new on the shortage list. And the result of that is a temporary permission for compounding pharmacies to make that drug and make it available in generic form, despite the fact that the original company that made that drug has a patent on it. And those patents, I think, last for 22 years. Don't quote me on that. I definitely know it's more than 20 years. But so typically drug companies spend a lot of money developing drugs, and then they get a patent on it, and then they have exclusivity on that drug for however long their patent has, right? And so GLP-1s became widely available, and a lot of med spas and other providers started to offer GLP-1s. And then the companies that made those caught up. They made new manufacturing facilities. This Eli Lilly and Novo Nordisk, the makers of Ozempic and Zepbound, they caught up and they were able to make more. And so after about 2.5, maybe 3 years of the shortage, that all of a sudden went away. And all these people that had started a business based on GLP-1s, all of a sudden they had to figure out, what are they going to do? Can they still operate? Can they still operate legally? And that is a whole morass, I'll tell you. Perhaps we can talk about that on another episode. We've covered it a little bit, but it keeps changing. But in any event, when you're doing something and you know that this is a temporary ability to do it, that it's going to go away. So that's what happened in New Jersey last week. So all of a sudden in New Jersey, NPs and PAs can't practice independently anymore. And they've got to find a collaborating physician to work with to keep going. Now, let's talk about why that is, okay? Because I know this is very controversial, and I'm just going to tell you, I think that there are pluses and minuses on both sides of this issue. And here's what's behind. Why do NPs need an overseeing doctor in some states, but not others? And why does it matter? Okay. So here's the deal. Doctors obviously go to medical school. That's 4 years of school after college. Okay. And then They do residency, which is basically 3 to 7 years. And a lot of us do fellowships, which is another 1 to 3 years. There's no reliable way to know if a med spa is following safety standards or cutting corners. The Med Spa Board certifies med spas that prove they're doing things right, legitimate supply chains, proper licensing, real medical oversight. It's the difference between guessing and knowing you're safe. If you're looking for treatments, go to medspaboard.com to find certified med spas near you. And if you already have a med spa you love and they're not certified, send them our link. And if you're a med spa owner doing things right, get certified and show your patients you're not cutting corners. So it's many, many years of education and training. For me, it was 10 years. For many doctors, it's only 7. 7's the lowest number of years of education and training that any doctor has. But anyway, it's a lot. Let's just say it's a lot. And then, we obviously have a very broad education about all kinds of different things so that when something unusual happens, hopefully most of us know how to deal with that or know when we don't know and know that we need to refer to a specialist. Now, nurse practitioners and PAs have 2 years of education after college, and that's it. There's no residency. There's no fellowship. Some people will argue they did a residency. There are some short-term training opportunities for nurses, for nurse practitioners and PAs, but let's just say the vast majority have absolutely no postgraduate training at all. And then they go out and find a job. Now, typically, most people will get a job in a doctor's office or a hospital, and they will start to get subspecialty expertise in whatever that field is. But since med spas have come around, we've existed for the last, 20 to 25 years. A lot of NPs and PAs are very entrepreneurial and go right out and hang up a shingle and start an aesthetics practice, which actually I really have no problem with, as long as people know what they're doing, know what they know, and know what they don't know. That is critical, right? So that when there is an emergency, there's a complication, they know how to treat it, or they know who to refer to treat it, okay? But the bottom line is that for the law, should the law treat nurse practitioners and PAs the same as doctors? And the nursing lobbies would say, absolutely, nurse practitioners should be able to be independent and do what they do, and they don't need a doctor. And of course, the doctors are busy saying that's ridiculous. They don't get anywhere near the training that we do. They shouldn't be allowed to practice on their own. Now, I'm going to just insert my opinion here. I think that people should be able to practice within their knowledge base. If they know what they're doing, they're going to be good at it. There are so many nurse practitioners who are really fantastic at aesthetics. There's no reason they shouldn't be able to do that, but they also need to know when they know something and when they don't, and when they need to refer out. The worst cases of this really don't have anything to do with med spas. It's mostly having to do with emergency rooms and urgent care. If you Google nurse practitioner, lawsuit, and urgent care or emergency room, you will find a lot of articles about people who've died because of a misdiagnosis by a nurse practitioner who just didn't know what they were doing, didn't know enough. So in our economy, the hospital administrators and the business people who run urgent care centers, they want to keep their costs down. And the highest cost in any business is payroll. The highest cost is labor. It just is when you run a business. And if you're someone like me, pay your people a lot of money because you really value smart people, hardworking people. You never want them to leave. You train and train and train them. You never want them to part from you. It's going to happen sooner or later, right? So in someone like me, my labor costs are very, very high. But let's say you get a bean counter to run your urgent care, okay? They don't want to pay expensive people. They want to cheapen that. They want to pay the least amount for their labor as possible. So many emergency rooms have decreased the number of emergency room doctors or even eliminated ER specialists entirely and hired nurse practitioners instead, okay? This has been particularly problematic in freestanding ERs. There are some states that have freestanding ERs that are owned by private equity. This is not every state. I have friends in Texas and also Colorado who have been very concerned about this because these freestanding ERs are now owned by private equity, and they fired all their ER docs, and they're staffed with mid-level practitioners who really have never had any residency in emergency medicine. So a lot of the people who are very upset about this entire issue has nothing to do with medical spas or aesthetics. But that's a really big deal. If you have a 4-year-old who's dying and might have meningitis or, something life-threatening, and that is misdiagnosed by a mid-level practitioner who doesn't recognize it, then that's a case I can put in the show notes that happened in Texas. Is quite a horrible story, but that is egregious, right? And that was all so that the business could make more money and save money off of, people's lives. So let's get back to med spas, okay? There are complications at med spas, and I think that that's really, really important to address. And I think that, because in medical spas, we are treating healthy, beautiful, amazing people, and we're just trying to make them look and feel better or more youthful. In my opinion, that's what we're doing. We should not be taking a risk with them. We should not be risking their lives. We should not be risking any kind of permanent harm. I am very, very conservative in my practice. Okay, but there are some risks. And how do you mitigate those? You want to make sure that the people doing this know what they're doing. They know anatomy inside and out, which, by the way, even as a radiologist, I call myself a recovering radiologist. We study anatomy as much as surgeons do, but obviously we study it on imaging. Surgeons study it by opening people up. But most people who don't do one of those things don't know anatomy as well. I'm just telling you. Now, of course, ER docs, they know their anatomy because they do all these procedures, but it's a spectrum of how detailed one's knowledge of anatomy is. And I will tell you that's the most important thing to know when you're sticking a needle in a human being. You want to know what it is you're sticking your needle in any event. So realistically, though, can a med spa be run by a nurse practitioner? Absolutely. And, should there be collaborating physicians? I'm not going to get into that. In some states, that's the law, and you got to do it, period. In some states, nurse practitioners do not need to work under a doctor, and that is the law. And as long as they know what they're doing and know what to do in emergencies, that's totally fine. If you want to change the law, you need to do that. You need to lobby politicians. You need to, but most of us are operating with a very keen sense of doing it legally and compliantly. And if somebody is out there knowingly breaking the law, I have a really huge problem with that. So in New Jersey, as painful as it is, the nurse practitioners who started med spas over the last 6 years, they're going to have to find a collaborating physician in order to practice legally. If they don't, they're out of the scope of their license, and they are risking losing their license, or at worst, but being arrested. So that is what's happening in New Jersey. It is awful that it's happening all of a sudden. I don't think that people had warning of this, but they had to have known when they started their business that this could potentially happen at any time. So wherever you are, just make sure that the place that you're going has licensed practitioners who know what they're doing. Look up their license and look up the medical director. Make sure that person actually knows about aesthetics and is actually medically directing. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.